it's going to be ready in probably like 5 to 10 seconds.
Yep, it says it's streaming live now on YouTube. Perfect. All right, Lama, if you could open the webinar.
Perfect. I'm not able to see how many people are here yet, but I'll say good evening to everyone as you're all trickling in. Thank you for being here and thank you for your patience. So you should be able to see us through Zoom if you're here available on Zoom. There's also a YouTube live stream as well. And, you know, because we only have an hour or so together today, we're just going to get started. But as I'm going through some of these logistics, please share the link with your friends, with your family. If there's any questions that you have, you can insert them within the Q&A function that's in the bar on your Zoom, or you can email me the email that's on this page, the cphillips@blackhealthalliance.ca. I'll also be just checking my email sporadically throughout this event, so you can send that there as well. But you know, if there's anything else, any other questions that you might have for us, please leave them in the Q&A or send them to that email. But I'll just go into some of the greetings for today. My name is Cheryl Phillips. I am the project manager for the Black Health Alliance, our Black Code Resilience Health Promotion Project. And something that we are really passionate about is community engagement. And we think events like this one, this town hall, is an amazing opportunity to do what is needed to be done during COVID, is to enhance the health promotion efforts around COVID and to be able to provide space for all of your questions around COVID to be answered. And we know that we only have around 40 minutes or so of time to go through some of those questions. So we'll try our best, but even if we can't get to all questions, we will try to make a way to either provide some of these answers after the event or email back. You know, if you email me directly at cphillips@blackhealthalliance.ca, we can try to email you back within the next week or so with some of those responses. But we want to do it as much as we can to make this as accessible as possible. And with that being said, I'd just like to give thanks to Black Health Alliance for all of the work that's been put into planning this event. And the same goes for all of the other sponsors who've been really crucial to planning of this event. They're on here on this screen. I think the fact that we're able to be here today and have events like this is not the first town hall. There's been at least a handful of town halls prior to this. And it's because all of these partners are coming together to make this possible. So thank you. With that being said, I'd like to pass the mic over to Anu, who will be doing our land acknowledgement.
All right, thank you, Chantel. So like Chantel said, my name is Anu, and I've been working with the Black Health Alliance on the COVID Resilience Project. So I'd like to begin by honoring the land that we're on, which has been the site of human activity since time. It is the traditional territories of the Huron-Wendat, Anishinaabeg, the Chippewa, the Haudenosaunee Confederacy, and most recently, the Mississaugas of the Credit River First Nations. These nations and this land were subject to the One Dish with One Spoon, Wampum Belt Covenant, an agreement to peaceably share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. Today, Toronto is under Treaty 13 and is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. I am mindful of the broken covenants and strive to make this right with the land and with each other. We are all treaty people. Many of us have come here as settlers, immigrants, newcomers in this generation or generations past. I'd like to also acknowledge those of us who came here involuntarily, particularly as a result of the transatlantic slave trade. And so I honor and pay tribute to the ancestors of African origin and descent. So with that, I'd now like to introduce Cheryl Prescott, the Executive Director of Black Creek Community Health Center and our moderator for tonight.
Okay. Good evening, everyone, and welcome to you all. I know that it's the eve of a long weekend and the midst of a of Holy Week for many of us. Our Jewish friends were recognizing Passover and our Christian friends looking forward to Good Friday and the Easter weekend. But really happy to have you here with us this evening for this important conversation. We all know that COVID has had a devastating impact globally on many of us, but in particular on the Black and racialized populations. So we would like to have this conversation about vaccines for us to all understand a bit more about the development of these vaccines, the efficacy of the vaccines, and to answer some of your questions. I know that you were invited to submit some questions to Chantal before this evening, and I believe that we've synthesized these questions, and the format of tonight will be to just ask some questions to our guests, who I will introduce shortly, but just wanted to frame the evening as well by saying that data that has been collected, especially in other jurisdictions, other countries, because Canada's not caught up yet, shows the disproportionate impact of COVID among Black people. The number of cases, the number of hospitalizations, the number of deaths of people that identify as Black. In the US, the death rate is 9 times higher than white Americans. So, and at the same time, throughout this pandemic, we've been reeling from witnessing things like police shootings and death and murder of Black individuals. We've seen Black Lives Matter protests, and we've seen just an emboldenment of other white supremacy movements in the US especially. So it is not surprising that when we look at some of the statistics around the hesitancy to the vaccine from the Black community, that this is born from some of not only the historical issues, such as the research that has been done on the Black community, most notably the Tuskegee experiments. So, and today we continue to see some instances of the maltreatment and mistreatment of members of the Black community from the healthcare system. So there is some doubt. There's established doubt. There's continuing doubt. There's doubt in the trustworthiness even of the science and of research institutions and the governments that we are all living with. So what we're doing here tonight is to just talk about that. We want to have some factual information. We want to counter also the wealth of information that's out there, especially on social media, that may not be backed up by fact. And we're really pleased to be able to have two esteemed guests with us this evening, two physicians who have really spent, I would say, among others in the profession, so much time because they care about our community. And they're here to give us some information, to answer some questions. And I really hope that we can all go away tonight with that information to help inform our own decision about the vaccine, whether it's for ourselves, for our loved ones, for our co-workers. It's important that we have the facts to make an informed decision. So with no further ado, it's really my pleasure to welcome Dr. Zainab Abdurrahman, who is the Chief Immunologist and Allergist at McMaster University, as well as Dr. Upton Allen, who is the Chief of the Division of Infectious Disease at the Hospital for Sick Children, as well as a professor at the University of Toronto. So I will begin by asking both maybe Dr. Abdurrahman to say some introductory comments, and then followed by Dr. Allen, and we'll go on into our questions.
Thank you so much. Firstly, thank you for inviting me. As has been mentioned, I am truly passionate about this. Any opportunity for our community to be able to come together and ask questions and have others understand where we're coming from. I think that vaccine hesitancy can be viewed in so many negative fashions or looked as being anti-vaccination versus people are not keeping in mind the history, the previous transgressions towards people who are Black or other visible minorities who have had major government-led initiatives, go against them. And so trying to promote something on such a level without knowing that history, I think, can cause people to not feel comfortable. And so we're here to provide, the facts and provide you with any answers to any of the questions that you have, knowing that we are aware of reasons why you might be more concerned or a bit more worried about a large government rollout, knowing that there has been history where the government has not perhaps been kind to people who look like us. So we're here to answer your questions in hopefully a format that you feel comfortable to ask us anything. And I hope that you walk away with this with more information, because truly that is the key to success. Thank you.
Thank you. Dr. Allen, any opening remarks?
Thank you very much, Cheryl. And again, it's a real privilege to be here today. And thank you very much for inviting me. I think at the end of the day, what I would like to ensure is that when people make decisions about whether or not they should take the vaccine, which they have a right to decide yes or no, that they make that decision based on correct information and not wrong information. And I often say to myself, I would not be able to sleep comfortably if I knew that somebody did not get vaccinated because they acted on wrong information that was being circulated through social media, and I had an opportunity to fix that. And so sessions like this one today provide an opportunity for information sharing, so that at the end of the day, if someone makes a decision, it can be based on correct information, and they can decide which way they want to go with respect to vaccines, but not based on wrong information.
Great. So thank you both for that. And I think it's really frames our conversation well. And I would like to invite everyone to sit back, grab a glass of water. It's only about an hour, but 45 minutes. So we're going to get right to our first question, which is, I will direct to Dr. Allen. Could you tell us about the different types of COVID-19 vaccinations available to Canadians? We know that several have been approved for use in Canada. And how do they differ? And is one better than another? And could someone choose to receive one over the other?
So those are really great questions. The first one that I'll address is, can one choose one over the other? There's no plan at the moment to offer choices like that at this point in time. And that is when you book an appointment, or an appointment is booked for you, or you show up, or somebody come to you. But at the point of being vaccinated, what you are offered is what is planned for you to be given. Yeah, there have been cases of people who have declined one vaccine and try to get in another line somewhere else for another vaccine. But at this point in time, the plan is for you to get a specific vaccine rather than one of three choices. In that regard, there are 3 vaccines now that are available for use in Canada: the Astrozenica Vaccine, Pfizer, and Mrna Vaccine. So what are the different types of vaccines? So broadly speaking, there are 2 categories of vaccines as far as Canada is concerned at the moment. There are more than that in terms of number of categories, but as far as Canada is concerned, in terms of what's being used, 2 broad categories. The first category is referred to as the mRNA vaccines, and those are the Pfizer and Mrna vaccine. And the second category is it's called a vector vaccine, and that is the Astrozeneca vaccine, and eventually the Johnson vaccine will also be that same category. And so in a nutshell, I know we don't have a lot of time, let me try to explain the differences between those two. So essentially what the mRNA vaccines do is that they deliver a message to our body's cells to make a specific protein called a spike protein that our immune systems respond to and create antibodies that fight infection. And the way to think of that is like a postman delivering a message to your home and then disappears. So once the message through called an mRNA, messenger RNA, is delivered, the mRNA breaks down very quickly, and like the postman, it's gone. It doesn't hang around. The second category is the vector vaccine. And essentially what happens there is that the message is being delivered by a harmless virus that related to the family of viruses that cause the common cold. But this one is not one that is going to be causing us to get ill. And that virus transports a message to our cells and uses the machinery of our cells to make spike proteins that our immune system then responds to. So the net result is almost the same as the mRNA vaccine. In other words, a spike protein is produced and our bodies respond to that.
Okay, great. Thank you so much. And just another follow-up question to that. Not too many of us are geneticists, I'm sure, in the audience. So we're hearing a lot about mRNA and DNA. So, and one of the things I've heard in our community is, can this vaccine change your DNA and change your genetic makeup? How can you comment on that?
The answer to that is no. If these vaccines could change our genetic makeup, it would be the greatest discovery in the history of mankind. It's just not possible for that to happen for many reasons. And that is, it's such a complex process that would require special enzymes and chemical reactions in our bodies. Bottom line is that it doesn't happen. And so there's absolutely no concern that the mRNA vaccines would alter our DNA, and neither will the vector-based vaccines. They won't alter our DNA at all. And another way to think of it, as far as the vector ones, is that when you get a cold with a cold virus, that doesn't change your DNA. So if a virus, which is what the vector is called an adenovirus, if that infects you, it doesn't change your DNA. So when you get an infection through a vaccine with a harmless adenovirus, it's not going to change your DNA. So bottom line is that your DNA, fortunately, is completely untouched.
Wonderful. Thank you so much. I hope that that's got through to our audience. I think that was very clearly described. So now that we've heard about the different types of vaccines, the adenovirus vaccines, the mRNA vaccines, I'm now going to turn to Dr. Abdurrahman and ask you, talk about the fact that many people are also concerned about the rapid development of these vaccines. So could you talk a bit about how these vaccines were developed, how they were tested, and in particular, were they tested on Black people?
Absolutely. This is a question that I think really plagues a lot of people. So every vaccine, every medication that is approved in Canada has to go through the same rigorous testing, which requires 3 phases. So there's a phase 1 where we look to find what is the best dose, and then we look to make sure that it is safe. And we even try much higher dosing to make sure that that still remains safe. And then you do a big trial, which is the phase 3, where you make sure that not just was it a safe dose and a good dose, but it's actually effective in preventing, in this case, COVID-19 infection. So That happens with every medication that is approved and every vaccine that is approved in Canada. And all of the vaccines that are currently approved for use have completed all of those 3 types of studies, which is required. In terms of people feel like it was very quick, it was very fast. This was a time when the whole world was focused on one thing. And there was a lot of funding that went towards a lot of these companies to help work on these. Even if their vaccine did not work, they were given funding to do this, even if theirs didn't pan out. So there were many that did not continue, but they were able to focus on this and just work strictly on this in a tight timeline, knowing that we were going through a pandemic. So all of those phases still happened. All the safety checks, which is required, still happened. And what is now more common compared to before is now there is a focus on equity and diversity, which, you know, if you go back 20, 30 years for a lot of the medications we use, there wasn't a big push to make sure that there were different kinds of people in these studies. Now there's a push to do that. So in these studies as well, they had somewhere about 9 to 10% of people who identified as being Black or African American, which is very different from a lot of the other vaccines that we've been using for many, many years, where they didn't actually try to recruit people who were of different minority races or visibly different. So yes, were we included? Yes. What's important though for me to tell you is that even though we are of different races, our genetics are the same. Okay, so when you look at humans, we're all the same. The thing is that's different in terms of race is not race that's the issue. It's actually just the different forms of systemic racism that has put certain minorities at a disadvantage. And now because of that, we have a lot of different issues in terms of access to healthcare can be different, or responses to, you know, complaints like, you know, the whole thought that people who are Black or African American do not have the same pain thresholds. So those are actually issues of systemic racism, but race-wise, it is the same. So from that perspective, you know, all of these were studied, and, you know, they come from a history of a long period of actually looking at things. So I know people feel the mRNA vaccines are totally new, but actually they were being studied when we had SARS back in the day. But the reason they didn't kind of continue into a large use was SARS didn't keep coming back as we thought it would. Similarly, there was a bit of MERS, which is the Mediterranean form of this, but these ones didn't pan out. They thankfully didn't pick up speed and cause a pandemic. But what happens is, you know, drug companies prioritize if something is worth kind of continuing to kind of develop on a large scale. So they did not, because those diseases were not prominent anymore. But this technology had already been harnessed for those, but we just didn't have those other diseases as a big issue. But so that this kind of work has been done for about somewhere between 10 to 20 years, but it was finally the opportunity to be able to use it, since this is in the similar family as SARS. So there's a lot of back research that was already done, and now it presented opportunity for this particular disease, but it still went through all the rigorous testing. But there was just a focus of energy, you know, expertise and money towards making these vaccines happen in a shorter time period.
Great, thank you. I think that should alleviate some of the concerns about the rapid development of these vaccines, because as we all know, because this was a global pandemic, all hands were on deck and lots of resources were put into developing these vaccines with technology that is not brand new, but has existed. So thank you again for that. So would you say, is there any evidence at all pointing to the fact that these vaccines may have a different efficacy or safety amongst racialized populations, such as Black populations, compared to whites, for example?
Yeah, so when all the studies were done, they always kind of break it down, looking at differences in terms of response, how well it worked, and as well as the safety data to see if there's any difference. And they look at it, you know, by age group, by gender, by race. They broke it all down and there wasn't a difference. So we still saw the same efficacy. So it worked the same way. And there wasn't an increased signal in terms of different races, in terms of side effects or adverse events happening. So that was not seen. And now even with the real world data, you know, over 100 million people have been vaccinated. So we're also able to see that there hasn't been, even with all the different, side effects that you can sometimes see, there hasn't been an increase in any particular minority group having worse side effects than others. So that's always continuing in terms of post-medication, post-vaccine monitoring that continues to happen whenever a medication is in use or a vaccine is in use.
Thank you so much. And I know that I guess I don't want to leave this line of questioning without pointing out the recent news of the Astrozeneca vaccine, for example, that everyone is now hearing. Just briefly, again, could you just say a few words about, the adverse effects and allergic reactions? And is there any difference or any potential risk to the Black community versus, again, any other community?
Mm-hmm. So with specifically, I know the AstraZeneca is hot on everyone's minds. There has been, some signals where they had seen some kind of clotting events there. And so, as much as people are very worried about this because they're hearing these reports, from someone who, wants to be able to reassure people, it tells me our system of monitoring is working. So whenever there's signals coming up, I want it to be reported. I want the different countries to be open about what they're seeing, because then all the countries share their information. And when they looked at it, yes, there are some kind of increased reports of clotting, but it's not actually, haven't found that it's so much more increased than the regular population. They haven't found any particular race being more adversely affected. As a kind of big precaution right now, our vaccine advisory committee, NACI, has decided, because we know generally we might see more clots in younger women, they have opted to not give it under 55 as a precaution. But many other countries actually continue to give it across the ages, and they're not seeing such a huge increase that it's causing them to kind of shut down those programs. But this is, if you're seeing something in one area, you hope that it would be shared across so that we can all evaluate the data and then make the right recommendations for our population. So as much as it might kind of cause a bit of fear, you should also be happy that they are sharing this information. So we share, they share, and we are all able to make sure that we're providing the safest options for those who are in the various countries.
Okay. Great, thank you so much. And again, on this, in a similar vein, I guess I'll go to Dr. Allen with this question. Are there any restrictions on who should take the vaccine? So for example, if I'm pregnant, I'm immunocompromised, or I have sickle cell anemia, or I've had COVID, or serious allergies, are there any concerns that I should have about taking any of the vaccines that are available?
So at this point in time, the only real contraindication, meaning only real reason why one shouldn't take the vaccine, is if you had gotten a first dose and you had a reaction to that first dose, then the doctors would be very careful as to whether or not you should be getting the second dose based on the type of reaction that you had. That's number one. Number two is if there's a component within the vaccine, within the vial, that you are allergic to, then there'll be a discussion with your doctors around that. So for example, the vaccines have at least some of the vaccines have a compound that's called polyethylene glycol. And that is present in other products such as cosmetics, certain bowel prep preparations, laxatives, some of them. And so there are some compounds that are contained in this. And if one is known to be allergic to that, then there'll be a discussion around whether or not you should be taking the vaccine. But the most common types of questions that we get asked is, if I'm highly allergic to shellfish, medications like penicillin, other things, can I, seasonal allergies, can I still get vaccinated? And the answer is yes. What would typically happen is that the vaccine center, area where you're getting vaccinated, would have you wait somewhat longer and the various allergists, Dr. Abdul Rahman and others can speak to this, would have a planned length of time for you to stay, like 30 minutes, as opposed to others who might have waited for a shorter period of time, like 15 minutes. And so the bottom line is that for the most common allergies that we hear about and we experience in everyday life, there's absolutely no contraindication to getting vaccinated.
Okay, great. So I've decided to get vaccinated. What are the benefits? I'll go to Dr. Abdurrahman for this one.
Okay.
To myself and to my general public.
Okay, so the benefits of vaccination are to protect you from getting infected with COVID-19. Obviously, in terms of any form of infection, what percent reduction kind of can vary a little bit. But what is about nearly 100% for each of the different vaccines is that you'll be 100% protected from death from COVID-19, from severe infection with COVID-19, and hospitalization with COVID-19. The issue with COVID-19 is, once you get quite sick with it, if you get hospitalized, your risk of death just skyrockets once you get severe disease where you require hospitalization. So that's what we're really trying to reduce. And that is what you're going to get with this. And then, so those are kind of the scientific things, but there's a lot of other things, we're hoping that as more and more people get vaccinated, we'll be able to hopefully over time, which might take a long time, but hopefully we'll start to kind of go back to some of the things that we were able to do, like participate more within our community, within our families. That's always kind of the end goal that we're looking towards. And that's what we're hoping over time when everyone gets vaccinated. But right now, when you get vaccinated, you're protecting yourself from serious infection, death, and hospitalization from COVID-19. So there are great benefits for getting vaccinated.
Thank you. Now, so I've gotten vaccinated. Can I still spread COVID-19? Can I still spread the virus? Dr. Allen, maybe I'll put this one to you. And not only that, we've been hearing in your answer, could you please maybe speak a bit to the variants that we're seeing now?
Okay, great. Thank you. That's a great question. So let me just frame that answer, the answer to that question by just echoing what Dr. Abdurrahman outlined earlier. And that is when vaccines are used, we target three main outcomes. Number one is we want to make sure that the vaccine prevents people from dying. And all the vaccines are pretty much 100%. That's great news. Second, we want to make sure that people don't have severe disease. And again, it's essentially 100%. And then the third outcome is prevention of any infection, including mild infections. And mild infections can be divided into two categories. One's where you're mild with symptoms, and the other where you're mild, but you have no symptoms. If you have mild infection, you have no symptoms, we call it asymptomatic infection, it is still possible that you having been vaccinated, if the vaccine is not 100% effective in preventing you from getting that mild asymptomatic infection, then it is possible that you could get that. And yes, you could transmit. Having said that, the studies are now coming out that actually show that the vaccines are actually very valuable in reducing the risk of transmission as well. But it is still possible, based on what we currently know, it is still possible for transmission to occur. Now, you're much more likely to transmit in a situation where you picked up a variant versus a strain of the virus that is 100% aligned with the vaccine. But if the variant's a little bit off, it might not be completely aligned with the effectiveness of the vaccine and might be a little bit off, then it could increase your chances that you'll pick up that variant and potentially transmit that. Are the variants things for us to worry about? Yes, because they're more transmissible, i.e. one person is much more likely to infect a larger number of people if they get infected. If you get them, the data show that illness is much more severe, potentially more severe, and the variants may also be associated with greater mortality, so greater chances of dying. So all of the reasons for us to try to do all the things that we need to do to reduce the risk of picking up and transmitting any form of the COVID virus. Vaccine is one issue. We still have to adhere and follow the infection control measures and physical distancing to reduce transmission overall.
Okay, great. We've been hearing a lot more about the variants in the last little while. Is it true that they are, early on in the pandemic, we heard that, COVID-19 it disproportionately impacted the elderly population. We're now hearing that, we're seeing a larger number of younger people being impacted and infected, hospitalized. Could you just comment on that for us?
Yeah, thank you very much. With basically what we're seeing now over the last several months is a shift towards younger people showing up as being positive. And some of the reasons for that are unclear, but it begs the question of whether or not there's some degree of pandemic fatigue creeping in that might be influencing people's behaviors. But we're definitely seeing a trend towards younger people showing up as being positive, and we don't think that it's related to any medical reasons or reasons that are related to how their immune system functions, but rather how they got exposed. So potentially, it's something that we can do something about.
Okay, so on that note then, I'll pose this question to Dr. Abdirahman. What can I do after I get vaccinated? So will I still have to wear a mask? Will I still have to behave socially responsible by being distant?
Yes, the answer is yes. So after you're vaccinated, you will still have to wear a mask. You will still have to follow the public health guidelines in terms of physical distancing. But the thing is, we don't want you to think that the vaccine is the be all end all and that's it. It's another tool in our toolbox along with all these other measures. And you have to remember, not everyone's going to get vaccinated at the same time. It's coming down. We're kind of going, step by step. We started with those who are in long-term care, who are kind of the highest risk, the ones who were dying quite a bit, especially in the first and second wave. So we started with them, and then those who take care of them, other healthcare workers. Now we're going kind of age demographic by demographic, and then those with who are at higher risk for various reasons. So everyone is not going to be vaccinated at the same time. So we're still going to have to adhere to the other public health guidance. So this is something else we can add in terms of our protection from COVID-19, but we still are going to have to follow the other rules as before.
Great. So in saying that, some are asking, if this is the case, if I have to continue acting the same way, why should I get vaccinated?
So the reason is because, things go, like I said, it's step by step. I wish there was an easy thing to vaccinate everybody at the exact same time, but unfortunately that's not the case. But eventually, the goal is for us to eventually get out of this, but we're going to need all of these tools in place to hopefully then eventually lessen some of the rules when everyone has been vaccinated. As we know, we're kind of going through all the adults now. There's good studies coming out from the pediatrics data now. So I'm hoping that as we keep going, we'll be able to fully vaccinate everyone. And then with that, we'll hopefully not get as much of the issues we're having with a lot of kind of transmission and various issues there, because we'll actually be less likely to get infected. So these are important things if you want to come out of this, because I would like to think of a time when we no longer have to wear the masks. So it's a long game. This is not a short game. And I think we've already seen that. We've been in this pandemic for over a year now. So it's not going to be something that's going to, I'll just snap our fingers and go away, unfortunately.
Great. And you say it's a long game. Maybe Dr. Allen, I'll pose this question to you. Many people are saying, well, I'll wait and see. You know, I don't want to be the first batch to be vaccinated. What's the impact of that decision? Or if many of us make that decision?
There are two ways of looking at the impact of not being vaccinated. And Cheryl, I will share with you one of the ways to look at the impact. I was stopped earlier this week in the corridors by somebody who works in the hospital. He is one of the janitors, and he basically said, you know, essentially what you're asking, why do I really need to get vaccinated if I have to put on, you know, mask and all those things afterwards and physically distance? And I said to him, chances are if you get vaccinated, you shouldn't end up in hospital with COVID, and you shouldn't die. And he was sold in a minute. He said, I'm good. Really, because I saw him the next day and he said, you know, thanks, doc. I mean, if he got COVID, it's going to be mild illness. And so protecting oneself is so important from severe outcomes of COVID. But there's another reason, and that is contributing to protecting loved ones and society as a whole, through the whole concept of herd immunity or community immunity, where the way we think about community immunity is almost like a forest fire, Cheryl, where there's a forest fire marching through the forest. And the way you interrupt it is that the firefighters run ahead of the fire and clear out, do a clearing, removing all the trees and shrubs and everything. And fire, once it reaches that point, it stops. And essentially, that's what community immunity is. And we all can contribute to that by preventing this COVID fire from marching through, because it will stop once it reaches people who are less likely to get ill with it and less likely to transmit.
Thank you for that story.
Sorry, just to add one thing. The whole thought of, I don't want to be first, you are not first. There have been so many people who have been vaccinated ahead of you. The US, which I quote a lot because they're using similar vaccines as we do, especially with the first two that were introduced here, they've already given out about 150 million doses. So obviously some of those people have gotten their full course of two, but they've given out that many doses. So you're by no means first. And some countries have vaccinated over 50% of their populations. So you are not first. If you haven't gotten the vaccine in Canada too, you're also not first in Canada. So there are many people who've already gotten it. You've already waited till your turn. So I would encourage you, when it is your turn, to go out and get the vaccine, should you choose to.
Thank you so much. I think we've come to the end of our questions that we had planned to ask, but before we move on to, I think, the last segment where we'd like to share some information as to how people can find out how to get the vaccine, should they wish to get the vaccine now. I wondered if there was one thing, what's a take-home message? Or, well, we're all home probably, but what's a message you'd like to leave folks with tonight that really, to encapsulate, what your beliefs are, I guess, around this whole issue of vaccine hesitancy amongst our community. We're hearing about even healthcare workers like yourselves who are very hesitant to take the vaccine. They're working in situations that are putting themselves at risk and hence their families and loved ones at risk. So what is one thing you could say to us all around your decision to take the vaccine if you have done so?
So it's a great question, and there are many take-home points. But what I would say is that there are a number of individuals who are, Black folks and folks from racialized communities more generally, who have your back, who are looking at this situation very carefully, with a view to, raising the alert if for some reason the monitoring process indicates any signals. And so that is so important that, the process of certifying the vaccines as being safe is not one that stops with the injection in your arm. We follow things very carefully to see if there are any rare events that happen, with an emphasis on rare. And so those events that happen after the studies have been done, they would be classified as being very rare. But we're still looking out for them. I think that is so important. So we have your back. We have our backs. We're looking out very, very carefully to ensure that that nothing gets missed in this process of rolling out these vaccines to the communities, Black as well as non-Black communities. I think that is so important. But the other, if I might sneak in another take-home point, is coming back to what said earlier, and that is it's really important that if we make a decision not to be vaccinated, I personally would feel really bad if somebody made it based on the wrong decision. So for example, if somebody said, I didn't get vaccinated because I think this thing will change my DNA, I would feel bad about that. So if you have questions that are that you haven't got answers to, reach out to somebody, reach out to community leaders, reach out to somebody who you trust, so that you can get some answers, so that when you do make a decision, at least it's based on the right information.
Thank you. Great advice.
And, I echo what Dr. Allen said 100%. I think the things I would add are this. At the beginning, when Cheryl went over the statistics about the racialized data, it is real. Black and racialized populations have been more adversely affected by COVID-19, not due to race, but due to the systems that are in place that make it harder to sometimes fully participate in the preventative measures, and have so, as a result, we've seen higher death rates. And this is the time that we can use this vaccine to change the narrative. So this is the chance for us to reclaim our communities, become safe within our communities, and hopefully return one day to the way our communities basically work best is when we can interact with each other, because we are social beings. We want to be able to see each other in places of worship or at the births of children or other celebrations. So we want to be able to celebrate again. So this is that opportunity to change the narrative. And if it's true, if you do have questions still, if there are things that, maybe still don't sit well with you, ask someone. There are trusted community leaders. You have trusted healthcare workers in your kind of realm. Engage them and ask them. And, you know, no question is a silly question. Don't be worried about what the question is. Get your questions answered so that you can make a decision having all the right facts. And, you know, there's been a lot of these that we've kind of participated in. Go through, watch some of the other ones. Maybe if we didn't get to one question of yours today, maybe it was covered somewhere else. But really just take the time and make sure that you make the right decision for yourself, and think about all the benefits of this for you, your family, and your community. We're all in this together, and we really, like Dr. Allen said, you know, we've got your backs, and that's why we're here talking about it.
Right. Thank you so much. What a wonderful note to end on. I think I just wanted to reiterate, you know, despite the history, and that history was in denial of service, denial of access, and we now have access. And I think we have to ensure that we take that. So, you know, with being mindful of the right information. And this has been such an important session, and other sessions that we've had. Really appreciate the generosity of time that you and other professionals in the medical field, especially Black professionals, have given to this conversation, really to reduce the misinformation and reduce stigma. You know, the chat has been very active. I've been keeping an eye on it, and really, you know, powerful questions, great questions. And to your point, I really invite folks to go on YouTube. There's so many of other sources of factual information out there. And I think on that note, we're coming close to time. We wanted to give you an opportunity to find out exactly how you can have access to the vaccines, what is out there now. It's very confusing for some. So again, big thank you to both our guests and to everyone who took the time this evening to join this conversation. And I'll turn it over to Chantel.
Yes, thank you both so much, including Cheryl, for your wonderful moderation. And, you know, one of the questions in the chat was, you know, whether any of us have been vaccinated. And I'm also a medical student at the University of Toronto, and I actually received my first dose of the Pfizer vaccine on Tuesday. So I think it's also important for us to role model that we wouldn't be conducting events like this if we didn't feel safe doing or partaking in this ourselves. So I think setting that example is really important. And of course, I know me being a medical student does precipitate my access to this, but I am hoping that very shortly in the next few months that this will be the case for many more within our community. And so as you're preparing to navigate the systems and infrastructure around vaccination, I'm just going to share my screen so that we can walk through some of the resources that exist right now. So one of them is through the actual Ontario website. And the first is this book vaccine option. So I'm going to just put this in the chat for you. So if you are unclear about whether you can get the vaccine, you can go to this website. It's updated very regularly. Like we see it was updated today. And you can insert your postal code. So if you put in a postal code, this is the Black Health Alliance postal code, and then you can view eligible groups, and they'll show you everyone who's eligible based on the date that it was last updated. And so you can select whichever option you fall under. And so let's say frontline healthcare worker, and it'll give you a number to call so that you can actually book through the City of Toronto Health Unit or any city that that's related to the postal code that you inserted in here. So if you put your own postal code or even your work postal code, then you'll be able to access this number. I don't know how long it will take to be booked or how long you might have to wait. But if you wanted another option, the second option is to actually just look at the various pharmacy vaccine locations. I'm also going to put that in the chat for you. So if you go to this link, you should be able to, once again, review some of the information that's on this page. So like it says, before you book, up to this date, it's 55 years old or older, as well as the OHIP card or other form of valid government issued identification. And then you can look through the different options that are available to you based on where you live. And I know a couple questions that I've actually heard previously is this question around if you don't have an OHIP card, like how do you navigate this structure? And so these are some of the questions that we want to be able to answer for you in the near future. So if you're interested in getting updates, including the transcripts from this town hall or any other vaccine related information, you can actually just register for the BHA newsletter. And so I'll put this in the chat as well. So if you go to that main page and you scroll to the bottom, you should come to this Get Connected section where you can put your name and your email, and we'll be able to provide some more information. But I also encourage you to subscribe or to at least go to the Black Scientists Task Force Facebook page. There's so much information there, as well as like the Black COVID Resilience, a project that I'm helping to lead. There's a lot of information that we're trying to make available to folks. So try to get as connected as you can. And I think these are the ways in which we'll prepare ourselves when, regardless of your age group, that the vaccine's available to you. So thank you for coming to this event, and I'll pass this off to Cheryl for her closing remarks.
Okay. Thank you all. Again, there's just a dearth of information out there. Many organizations also in areas, especially that are particularly hard hit by this virus. There are agencies that are there to support, to help people even fill out those forms that are on the websites to, to book a vaccine. So lots and lots of resources. I know that we're not at the end of this game. We've now been introduced to the new variants that are really competing with the vaccine right now. So we really have to keep vigilant. We have to make the right decisions, whether it's through our behaviors or our decision to take the vaccine or not. We have to continue being safe. And with that, I just wish everyone a safe and healthy weekend. And I hope everyone has a chance for some rest and rejuvenation, especially those of you that have been out doing all of this work. Chantel, Dr. Raman, Dr. Allen, thank you so much, and all the best.
Bye-bye. Have a great weekend.
Bye,
Bye-bye.
everybody.